Welcome back, everyone. Buckle up. Today we're going through 30 questions previously seen on the NCLEX. Only a few get them all right. Think you're one of them? Let's go. Question 1. Fluid imbalance confusion. A client with a history of heart failure is admitted with an extreme fluid volume deficit. The nurse reviews the lab results. Which finding should the nurse anticipate? 1. Decreased hematocrit, HCT, and decreased blood urea nitrogen, BUN. 2. Increased urine-specific gravity and increased serum osmolality. 3. Decreased central venous pressure, CVP, and bounding peripheral pulses. 4. Increased urine output, UO, and decreased blood pressure, BP. The correct answer is 2. Increased urine-specific gravity and increased serum osmolality. Rationale. Fluid volume deficit, dehydration, causes the body to conserve water. The kidneys concentrate urine, leading to an increased urine-specific gravity, greater than 1.030. The lack of water in the bloodstream concentrates solutes, causing an increased serum osmolality, greater than 295 milliosmoles per kilogram. Incorrect options. 1. Dehydration causes relative hemoconcentration, leading to a high HCT and a high BUN, due to poor renal perfusion. 3. CVP is low in fluid deficit. Bounding pulses are a sign of fluid overload, not deficit. 4. The body conserves fluid, so UO would be decreased. Clinique RN test day tip. For dehydration, think concentration. All concentration values, HCT, BUN, specific gravity, serum osmolality, will be high due to lack of water, except BP and UO, which will be low. Question 2. SIADH versus DI. A client is diagnosed with syndrome of inappropriate antidiuretic hormone, SIADH. The nurse knows that the highest priority intervention, besides seizure precautions, is 1. Administering IV 0.9% sodium chloride, NS, to maintain fluid balance. 2. Restricting all oral and parenteral fluid intake. 3. Administering a vasopressin antagonist, e.g., conivaptan. 4. Encouraging a high-sodium diet to stabilize sodium levels. The correct answer is 2. Restricting all oral and parenteral fluid intake. Rationale. SIADH involves excessive ADH, leading to water retention and dilutional hyponatremia. The core treatment is strict fluid restriction, often less than 1,000 milliliters per day, to allow the body to excrete the excess water and raise the serum sodium level safely. Incorrect options. 1. Administering any fluid, especially NS, will worsen the fluid overload and dilutional hyponatremia. 3. Vasopressin antagonists are powerful drugs used in severe cases, but the first line, most immediate, and independent nursing intervention is fluid restriction. 4. While a high-sodium diet is sometimes used, the priority in SIADH is to correct the excess water, not just add sodium, which can complicate the client's already fluid-overloaded status. Clinique RN test day tip. The key difference: SIADH clients are soaked inside, low UO, hyponatremia, so you restrict fluid. DI, diabetes insipidus, clients are dry inside, high UO, hypernatremia, so you replace fluid and give DAP. Question 3. Calcium versus magnesium. A client is admitted with both severe hypocalcemia and severe hypomagnesemia. When administering replacement therapy, which electrolyte should the nurse ensure is replaced first? 1. Calcium. 2. Magnesium. 3. Potassium. 4. Sodium. The correct answer is 2. Magnesium. Rationale. Magnesium is a necessary cofactor for the parathyroid hormone, PTH, to function. PTH is required for calcium regulation. If the magnesium level remains critically low, the body cannot effectively retain or utilize the administered calcium. Therefore, magnesium must be replaced first to allow the calcium treatment to be effective. Incorrect options. 1. Replacing calcium first will be ineffective or temporary without adequate magnesium. 3 and 4. While potassium is often simultaneously low, it is not required for calcium or PTH function. Clinique RN test day tip. Think of magnesium as the helper for the other electrolytes. Low magnesium prevents the correction of low potassium and low calcium. Always prioritize magnesium replacement first. Question 4. Shock priority. A client in the emergency department has a suspected spinal cord injury and a blood pressure of 80 over 40 millimeters of mercury. The client's skin is warm and dry. The nurse should recognize this as neurogenic shock and anticipate the first intervention to be 1. Administering a large volume IV fluid bolus. 2. Initiating a norepinephrine, levofed, infusion. 3. Administering an antibiotic to rule out septic shock. 4. Inserting a Foley catheter to monitor output. The correct answer is 2. Initiating a norepinephrine, that's levofed, infusion. Rationale. Neurogenic shock is caused by massive vasodilation due to a loss of sympathetic tone. The core problem is distributive. The volume is in the periphery, not the core. The definitive treatment is a vasopressor, like norepinephrine, to cause vasoconstriction and return blood pressure to a functional level. Incorrect options. 1. IV fluid is a treatment for hypovolemic and septic shock. In neurogenic shock, a massive fluid bolus is often ineffective and can lead to fluid overload because the primary issue is tone, not absolute volume loss. 3. Neurogenic shock is defined by the spinal cord injury and often has profound bradycardia, a key differentiator from septic shock. Vasopressors are the priority for immediate hemodynamic stabilization. 4. Monitoring output is important, but a vasopressor is the life-saving intervention. Clinique RN test day tip. Distinguish between warm shock types. Septic shock requires fluids first. Neurogenic shock requires vasopressors first. Question 5. Hypocalcemia assessment. The nurse is assessing a client who has been on prolonged bed rest. Upon inflation of the blood pressure cuff, the nurse observes carpal spasms. The nurse recognizes this as a positive Trousseau's sign and should immediately assess for 1. Signs of deep vein thrombosis, DVT. 2. Laryngeal stridor and respiratory distress. 3. Signs of hypocalcemia, such as U waves on the ECG. 4. Signs of hypomagnesemia, such as hyperactive deep tendon reflexes. The correct answer is 2. Laryngeal stridor and respiratory distress. Rationale. A positive Trousseau's sign is a clear indicator of hypocalcemia. The greatest danger in hypocalcemia is the excitability of muscles, which can cause severe muscle spasms, most dangerously in the larynx. Laryngeal stridor, a high-pitched breath sound, indicates laryngeal spasm, which is a life-threatening airway compromise. Incorrect options. 1. DVT is not related to calcium deficiency. 3. Hypokalemia is a separate electrolyte imbalance. The immediate priority is the hypocalcemia-induced airway risk. 4. While hypomagnesemia can contribute to hypocalcemia, the immediate, critical assessment is for the airway complication. Clinique RN test day tip. When a question points to low calcium, Chvostek's or Trousseau's sign, the highest priority is always airway. The muscle tetany can quickly lead to laryngeal spasm. Question 6. Compartment syndrome versus hemorrhage. A client who is 6 hours post-tibia fracture and application of a long leg cast reports pain out of proportion to the injury, unrelieved by narcotics. The nurse notes slight swelling and pallor in the toes. The nurse's first action is to 1. Place the client's leg at heart level and notify the provider. 2. Administer the PRN pain medication and reassess in 30 minutes. 3. Check the distal pulses, cap refill, and sensation in the toes. 4. Elevate the leg above the heart level to reduce swelling. The correct answer is 3. Check the distal pulses, cap refill, and sensation in the toes. Rationale. The client is showing classic early signs of compartment syndrome. The nurse must first perform a definitive assessment, that's the 6PS, to confirm neurovascular compromise. Before calling the provider or performing any intervention, the nurse needs objective data to support the suspected diagnosis. Incorrect options. 1. The leg should be kept at heart level, not above, as elevation can decrease arterial flow and worsen compartment syndrome. Notifying the provider is second to a definitive assessment. 2. The pain is unrelieved, so administering more narcotics is unsafe and delays definitive treatment, fasciotomy. 4. Elevating the limb above heart level is contraindicated for suspected compartment syndrome, as it impedes arterial flow. Clinique RN test day tip. When pain is unrelieved by narcotics and a potential compartment syndrome is present, assessment is the first step, followed by immediate notification. Never elevate the limb above the heart. Question 7. Pulmonary embolism, PE, diagnostics. A client is suspected of having a large pulmonary embolism, PE. The nurse reviews the initial blood gas results. Which findings should the nurse typically anticipate seeing in the early stages of a PE? 1. Respiratory acidosis, pH low, PaCO2 high. 2. Metabolic alkalosis, pH high, HCO3 high. 3. Respiratory alkalosis, pH high, PaCO2 low. 4. Compensated metabolic acidosis, pH normal, HCO3 low. The correct answer is 3. Respiratory alkalosis, pH high, PaCO2 low. Rationale. In the early stages of a PE, the client experiences sudden, severe anxiety and shortness of breath, SOB. They hyperventilate, breathe rapidly and deeply to try and improve oxygenation. This rapid release of carbon dioxide, CO2, leads to a low PaCO2 and an elevated pH, alkalosis. Incorrect options. 1. Respiratory acidosis occurs if the client decompensates and develops respiratory failure. 2 and 4. These metabolic imbalances are not typically the initial findings in a PE. Clinique RN test day tip. When a client is anxious, SOB, and unstable, like a PE, they hyperventilate. Hyperventilation always causes respiratory alkalosis. Question 8. Heparin-induced thrombocytopenia, HIT. A client receiving 4 heparin suddenly develops a platelet count of 75,000 cells per cubic millimeter. Baseline 250,000 cells per cubic millimeter. The nurse should recognize this finding and anticipate which immediate intervention. 1. Prepare to administer a dose of protamine sulfate. 2. Discontinue the heparin infusion immediately. 3. Increase the heparin infusion rate to prevent further thrombosis. 4. Administer a dose of vitamin K. The correct answer is 2. Discontinue the heparin infusion immediately. Rationale. This is a classic presentation of heparin-induced thrombocytopenia, HIT, where the platelet count drops significantly, often greater than 50% from baseline. Paradoxically, this condition increases the risk of new clot formation. The immediate priority is to discontinue all heparin products, including flushes, to stop the autoimmune response. Incorrect options. 1. Protamine sulfate is used for heparin overdose. The problem here is the reaction, not the dose. 3. This is contraindicated. Increasing the rate would worsen the condition and increase the risk of both bleeding and clotting. 4. Vitamin K is the antidote for warfarin, not heparin. Clinique RN test day tip. When an anticoagulant, heparin, causes a problem, the first step is to stop the drug. Remember that a sudden, significant drop in platelets while on heparin equals HIT. Question 9. Ventilator alarm priority. The nurse is caring for a client on a mechanical ventilator. The high-pressure alarm sounds immediately after the client coughs. The nurse's first action should be to 1. Suction the client's endotracheal tube, ETT. 2. Manually ventilate the client with a resuscitation bag. 3. Check the ETT for kinks or water in the tubing. 4. Administer the prescribed PRN sedative. The correct answer is 3. Check the ETT for kinks or water in the tubing. Rationale. A high-pressure alarm indicates resistance to airflow. The most common and easiest to fix cause is an obstruction in the tubing, such as a kink or water in the circuit. The nurse should check the least invasive, most common causes first. Incorrect options. 1. Suctioning is only done if the cause is secretions, which often follows a cough. but checking for a mechanical kink is faster and should be done first. 2. Manually bagging is for a low-pressure alarm or if the problem cannot be quickly resolved. 4. Sedation is for agitation/biting the tube, but the nurse must first rule out a mechanical obstruction. Clinique RN test day tip for ventilator alarms. High pressure to obstruction, kink, water, secretions. Low pressure to disconnection, leak, dislodgement. Always check the patient and the circuit first. Question 10. Digoxin toxicity. A client with chronic atrial fibrillation who takes digoxin is admitted with a potassium level of 3.0 milliequivalent/L. The nurse should recognize that this electrolyte imbalance places the client at high risk for 1. Laryngeal spasm. 2. Digoxin toxicity. 3. Ventricular fibrillation. 4. Atrial flutter. The correct answer is 2. Digoxin toxicity. Rationale. The normal potassium range is 3.5 to 5.0 milliequivalents per liter. Hypocalcemia, K, plus 3.0 milliequivalents per liter, increases the binding of digoxin to the cardiac muscle, effectively increasing the drug's effect and drastically raising the risk of digoxin toxicity, even if the drug level is within the normal range. Incorrect options. 1. Laryngeal spasm is a risk of hypocalcemia. 3. While dysrhythmias are the concern, the primary and immediate risk in this scenario is toxicity, which then leads to characteristic dysrhythmias. Example, ventricular bigeminy. 4. Atrial flutter is an arrhythmia, but digoxin toxicity is the underlying risk. Clinique RN test day tip. Remember the key relationship, low K. Potassium means high risk of digoxin toxicity. The NCLEX frequently tests this critical interaction. Question 11. IV administration confusion. The nurse is preparing to administer an IV push medication to a client who has a continuous primary IV infusion running. What is the nurse's first action? 1. Occlude the primary tubing proximal to the injection port. 2. Aspirate for blood return at the injection port. 3. Check for compatibility between the IV push and the primary infusion. 4. Flush the injection port with 3 milliliters of normal saline. The correct answer is 3. Check for compatibility between the IV push and the primary infusion. Rationale. The first step in safe medication administration is ensuring the drugs won't precipitate or inactivate each other. Checking for compatibility is a non-negotiable step of the nursing process, assessment, or planning before touching the client or the line. Incorrect answers. 1, 2, and 4. Checking for blood return, flushing, and occluding the tubing are necessary steps after determining the drugs are safe to administer together. Clinique RN test day tip. Compatibility is key. In medication administration, the first action is often a planning/safety check before the physical intervention.
All right, quick break, because I need to show you something that can actually change the way you study for the NCLEX. This is our AI feedback system, built right into the QBank dashboard. After every quiz, you don't just get a score. You get personalized insights that explain why you missed questions, where your weak spots are, and how to fix them. For example, it tells you things like which subject areas need urgent review, whether you're rushing through questions and leaving test time unused, step-by-step recommendations like taking focus quizzes to sharpen delegation, prioritization, or clinical judgment. Instead of just saying you scored 60%, it literally gives you a roadmap to improve. And that's just one part of the QBank. You'll also get challenging NCLEX-style questions that test real critical thinking, a clean summary sheet that tracks your progress over time, and a built-in computer adaptive test system so you can practice under real exam conditions. This isn't just question practice. It's smart, AI-driven coaching that helps you study smarter, not harder. If you're serious about passing the NCLEX on the first try, check the link in the description and start using the QBank today.
Question 12. TPN management. A client is receiving total parenteral nutrition, TPN. The nurse notices the TPN bag is empty, and the new bag from the pharmacy has not yet arrived. The nurse should immediately hang which solution? 1. Lactated ringers, LR. 2. 0.9% sodium chloride in S. 3. 5% dextrose in water, D5W. 4. 10% dextrose in water, D10W. The correct answer is 4. 10% dextrose in water, D10W. Rationale: TPN is a highly concentrated glucose solution. If the TPN is abruptly stopped, the client risks severe, rebound hypoglycemia due to the sudden lack of glucose and the body's continued high production of insulin. Hanging 10% dextrose is necessary to match the high concentration of glucose in the TPN and prevent this complication. Incorrect answers: 1, 2, and 3. D5W and saline solutions are not concentrated enough to prevent rebound hypoglycemia in a client whose body is adapted to TPN's high glucose load. Clinique RN Test Day Tip: TPN is primarily a concentrated sugar solution. If TPN is interrupted, the immediate threat is hypoglycemia. Match the concentration. TPN out mean D10WN. Question 13. Cushing's versus Addison's lab. The nurse is caring for a client with Cushing's syndrome. Which lab finding should the nurse anticipate? 1. Hypoglycemia and hyponatremia. 2. Hypokalemia and hyperglycemia. 3. Hyperkalemia and hypoglycemia. 4. Hypernatremia and hypoglycemia. The correct answer is 2. Hypokalemia and hyperglycemia. Rationale: Cushing's syndrome is characterized by an excess of cortisol. Cortisol's effects are: glucocorticoid effect causes hyperglycemia, high blood sugar. Mineralocorticoid effect causes retention of sodium and water but excretion of potassium, leading to hypokalemia. Incorrect options: 1, 3, and 4. These are the opposite of the anticipated findings, especially hyperkalemia, which is characteristic of Addison's disease. Clinique RN Test Day Tip: for Cushing's, too much steroid. Think high, low. High blood sugar, high sodium/water, low potassium. For Addison's, too little steroid. It's the opposite: low, high. Question 14. Hepatic encephalopathy. A client with cirrhosis and hepatic encephalopathy is prescribed lactulose. The nurse knows that the therapeutic effect of this medication is achieved when the client exhibits: 1. A decrease in abdominal distension. 2. An improvement in level of consciousness, LOC. 3. A decrease in prothrombin time, PT. 4. A decrease in serum ammonia levels. The correct answer is 2. An improvement in level of consciousness, LOC. Rationale: hepatic encephalopathy is caused by the buildup of ammonia in the blood, which crosses the blood-brain barrier. Lactulose works by trapping ammonia in the gut and promoting its excretion via the stool. The most visible and critical therapeutic effect is the improvement in neurological status, LOC, as ammonia is removed from the circulation. Incorrect options: 1. Lactulose can cause distension, but a decrease is not its primary therapeutic goal. 3. PT is a measure of liver function and clotting time, not the effect of lactulose. 4. While a decrease in serum ammonia is the mechanism, an improvement in LOC is the desired therapeutic outcome the nurse must monitor for. Clinique RN Test Day Tip: when a question asks for a therapeutic effect in encephalopathy, choose the answer that relates to the brain/neuro status, LOC, not the lab value, ammonia. Question 15. FHR deceleration confusion. The nurse notes a fetal heart rate, FHR, tracing with decelerations that mirror the contractions. The nurse should immediately: 1. Reposition the mother to her left side. 2. Increase the IV fluid rate. 3. Administer oxygen via face mask. 4. Continue to monitor the tracing. The correct answer is 4. Continue to monitor the tracing. Rationale: decelerations that mirror, begin, and end with the contraction are early decelerations. They are caused by head compression and are considered benign and non-hypoxic. No intervention is required. the nurse should simply document and continue to monitor. Incorrect options 1, 2, and 3. These interventions, position change, fluid, oxygen, are reserved for late decelerations, uteroplacental insufficiency, or variable decelerations, cord compression. Performing them for early decelerations is unnecessary. Clinique RN test day tip. Remember the FHR mnemonic. Veal chop to variable equals cord. Early equals head. Acceleration equals okay. Late equals placenta. Only variable and late require intervention. Question 16. Priority postpartum complication. A client is 4 hours postpartum. The nurse finds the client sobbing uncontrollably and stating, "I can't do this. I'm a terrible mother." The nurse also notes the client's fundus is boggy. The nurse's first priority is to 1. Call the psychiatric crisis team to assess for postpartum depression. 2. Stay with the client and provide therapeutic communication. 3. Perform fundal massage to prevent postpartum hemorrhage. 4. Notify the healthcare provider of the emotional distress. The correct answer is 3. Perform a fundal massage to prevent postpartum hemorrhage. Rationale. This is a high-level prioritization question. While the emotional distress is significant, the boggy fundus indicates uterine atony, placing the client at immediate, life-threatening risk for postpartum hemorrhage, PPH. The physiological safety of the client must take priority over the emotional crisis. Incorrect options 1, 2, and 4. These address the emotional state, which may be baby blues, but the boggy fundus is an immediate threat to the client's life. Clinique RN test day tip. When an emotional or psychosocial issue competes with a physiological issue, the physiological issue, ABC, always wins. Boggy fundus to bleeding risk, then top priority. Question 17. Manic episode. The nurse is caring for a client experiencing an acute manic episode. Which meal choice would be the most appropriate to offer the client? 1. A bowl of hot soup and a sandwich. 2. Chicken salad on crackers and a carton of milk. 3. A large plate of spaghetti and meatballs. 4. A steak dinner with potatoes and vegetables. The correct answer is 2. Chicken salad on crackers and a carton of milk. Rationale. Clients in a manic episode are often too restless and easily distracted to sit down for a full meal. The most appropriate food choices are finger foods that are high in calories and protein, can be carried, and require minimal attention to eat. Incorrect options 1, 3, and 4. Soup, spaghetti, and a steak dinner require utensils, prolonged sitting, and focused attention, which a manic client cannot tolerate. Clinique RN test day tip. For highly restless psychiatric clients, mania, severe anxiety, prioritize interventions that are mobile, non-stimulating, and easily consumed. Finger foods, calm activities. Question 18. Preeclampsia medication. A client with severe preeclampsia is receiving magnesium sulfate. The nurse notes the client's respiratory rate is 14 breaths per minute and the urine output is 20 milliliters. In the last hour, the nurse should immediately 1. Increase the magnesium sulfate infusion rate. 2. Administer the prescribed dose of calcium gluconate. 3. Hold the magnesium sulfate infusion. 4. Increase the IV fluid rate. The correct answer is 3. Hold the magnesium sulfate infusion. Rationale. Magnesium is primarily excreted by the kidneys. A urine output of 20 milliliters per hour, normal is greater than or equal to 30 milliliters per hour, indicates impending renal failure. The priority is to stop the magnesium infusion, as its continued administration will lead to a toxic buildup and inevitable respiratory/cardiac arrest. Incorrect options. 1. Increasing the rate is contraindicated and will cause toxicity. 2. The client is not yet showing signs of toxicity. RR is normal at 14, so the antidote is not warranted, but the pre-toxicity state requires holding the drug. 4. Increasing IV fluid may improve UO, but is less critical than holding the drug that is now becoming toxic. Clinique RN test day tip. Magnesium toxicity is not just about depressed reflexes and low RR. Impaired renal function, low UO, is a critical warning sign that the drug is building up to toxic levels. Question 19. Delegation for new onset. The RN is assigning tasks for the shift. Which client task should the RN not delegate to the licensed practical nurse, LPN? 1. Administering a dose of IV push pain medication to a stable postoperative client. 2. Performing a blood glucose check on a client with new onset diabetes. 3. Performing a focused assessment on a client reporting new onset dyspnea. 4. Inserting an indwelling urinary catheter into a client with urinary retention. The correct answer is 3. Performing a focused assessment on a client reporting new onset dyspnea. Rationale. New onset symptoms, especially those related to breathing, dyspnea, indicate an unstable client. The initial assessment, analysis, and evaluation of an unstable or new onset condition are the exclusive responsibilities of the RN. Incorrect options. 1. In most states, LPNs can administer IV push medications, excluding specific high-risk drugs, to stable clients per facility policy. 2. Simple data collection, blood glucose checks, can be performed by the LPN or UAP. 4. Inserting a Foley catheter is a procedure within the LPN scope of practice for stable clients. Clinique RN Test Day Tip. Remember, RN is for unstable, LPN is for stable. Any new onset, sudden, or unexpected change requires the RN. Question 20. Airborne versus droplet in masking. A nurse is preparing to transport a client with a history of pertussis, whooping cough, to the radiology department. Which action is appropriate for the nurse to take? 1. Have the client wear a surgical mask during transport. 2. The nurse should wear an N95 respirator mask. 3. The client does not need to wear a mask during transport. 4. Transport the client only when an isolation cart can accompany them. The correct answer is 1. Have the client wear a surgical mask during transport. Rationale. Pertussis requires droplet precautions. When transporting a client on droplet precautions, the client must wear a surgical mask to contain the large droplets. The nurse only needs to wear a surgical mask or none, depending on proximity. Incorrect options. 2. N95 masks are for airborne precautions, TB, measles. 3. A mask is essential to prevent droplet spread during transport. 4. An isolation cart is not required for transport for a known infection, only for contact. Clinique RN Test Day Tip. For infection control, the mask is about who wears it. Droplet to client wears a surgical mask, and nurse wears a surgical mask. Airborne mean the nurse wears an N95. Question 21. Priority for low peripheral capillary oxygen saturation. A client with a 10-year history of COPD has an oxygen saturation of 88% on a 2-liter nasal cannula. The client is awake, alert, and comfortable. What is the nurse's priority action? 1. Increase the oxygen flow rate to 4 liters nasal cannula. 2. Notify the healthcare provider of the oxygen saturation level. 3. Encourage the client to take deep breaths and cough. 4. Assess the client's current skin color and work of breathing. The correct answer is 4. Assess the client's current skin color and work of breathing. Rationale. In a stable client with chronic COPD, peripheral capillary oxygen saturation of 88% is often an expected finding and may be their chronic baseline. Before making any changes that could suppress the respiratory drive, like increasing O2, the nurse must first assess the client's current level of distress, work of breathing, mental status, skin color, to determine if this is an acute change or a chronic state. This follows the nursing process, assessment. Incorrect options. 1. Increasing oxygen is dangerous without an order, as it can suppress the hypoxic drive. 2. The nurse must assess the client's stability first before calling the provider. 3. This is a helpful intervention but is not the priority over assessment. Clinique RN Test Day Tip. When a lab or vital sign is abnormal but expected for a chronic condition, like low peripheral capillary oxygen saturation in COPD, the priority is to assess for acute changes first, then intervene based on the overall clinical picture. Question 22. Hypotonic versus hypertonic side effect. A client with severe cellular dehydration is prescribed 0.45% NS IV infusion. The nurse should closely monitor the client for signs of 1. Increased blood pressure and bounding pulses. 2. Hypoglycemia and confusion. 3. Laryngeal edema. 4. Intravascular fluid depletion. The correct answer is 4. Intravascular fluid depletion. Rationale. 0.45% NS is a hypotonic solution, less solute than the blood. Its purpose is to shift fluid out of the blood vessels and into the cells to treat cellular dehydration. The risk is that as fluid leaves the blood vessels, the blood volume drops, causing intravascular fluid depletion, hypovolemic shock, and hypotension. Incorrect options. 1. Bounding pulses are a sign of fluid overload, the opposite of the anticipated effect. 2. Confusion may occur due to electrolyte shift, but hypoglycemia is not the primary risk. 3. Laryngeal edema is not a primary risk of hypotonic solutions. Clinique RN test day tip. Hypotonic fluids, D5W, 0.45% NS, cause cells to swell. They fix cellular dehydration but deplete the blood volume. Hypertonic fluids, 3% NS, cause cells to shrink. Question 23. Insulin action time. The nurse administers regular insulin at 8 o'clock. The nurse should ensure the client receives their meal trays by which time to prevent hypoglycemia? 1. 8:05. 2. 8:30. 3. 9 o'clock. 4. 10 o'clock. The correct answer, 2. 8:30. Rationale. Regular insulin is a short-acting insulin. The onset of action is typically 30 minutes after subcutaneous injection. To prevent hypoglycemia, the client must eat within that window. Incorrect options. 1. 8:05 is too soon for the insulin to have begun acting. 3 and 4. 9 o'clock, 1 hour, and 10 o'clock, 2 hours, are too late. The peak action for regular insulin is 2 to 4 hours after injection. Clinique RN test day tip. Know your insulin onset times. Regular insulin, short-acting, means a 30-minute onset. Rapid-acting, Lispro, Aspart, means a 5 to 15-minute onset. Question 24. Cushing's safety priority. The nurse is planning care for a client with Cushing's syndrome. Which nursing diagnosis is the highest priority? 1. Risk for imbalanced nutrition related to hypermetabolic state. 2. Risk for infection related to immunosuppression. 3. Risk for body image disturbance related to fat redistribution. 4. Risk for fluid volume excess related to sodium and water retention. The correct answer is 2. Risk for infection related to immunosuppression. Rationale. Cushing's syndrome involves high cortisol levels. Cortisol is a glucocorticoid that causes severe immunosuppression. The highest priority is the risk of infection, as a severe or unrecognized infection can quickly become life-threatening, sepsis. Incorrect options. 1, 3, and 4. Body image, fluid volume excess, leading to hypertension, and altered nutrition are all important problems in Cushing's, but are not as acutely life-threatening as a severe infection in an immunocompromised client. Clinique RN test day tip. High glucocorticoid levels, Cushing's, or clients on high-dose prednisone, mean a compromised immune system. In these cases, risk for infection is usually the top priority. Question 25. Gastrectomy complication. A client who underwent a total gastrectomy 1 hour ago is noted to have bright red drainage in the nasogastric (NG) tube suction container. The nurse should immediately 1. Document the finding as expected and continue to monitor. 2. Gently irrigate the NG tube with 30 milliliters of normal saline. 3. Increase the suction setting on the NG tube. 4. Notify the healthcare provider. The correct answer is 4. Notify the healthcare provider. Rationale. Bright red blood, BRB, in large amounts from an NG tube post-gastrectomy is a sign of a postoperative hemorrhage from the surgical site. The nurse must immediately notify the provider and the rapid response team, as this is a life-threatening, acute condition. Incorrect options. 1. While a small amount of dark, old blood is expected, BRB is not. 2 and 3. Irrigating or increasing the suction can dislodge the clot forming at the surgical site and exacerbate the hemorrhage, which is strictly contraindicated. Clinique RN Test Day Tip. Never manipulate an NG tube in a client who has had a gastric or esophageal surgery. Example, gastrectomy, esophageal repair, gastric bypass, without a direct order, as it can disrupt suture lines. Question 26. Delegation for stability. Which client task is most appropriate for the RN to delegate to the unlicensed assistive personnel, UAP? 1. Removing a nasogastric tube from a client being discharged. 2. Obtaining a clean catch urine specimen from a new admission. 3. Documenting the intake and output, INO, for a client who is NPO. 4. Assessing the healing status of a stage 2 pressure ulcer. The correct answer is 3. Documenting the intake and output, INO, for a client who is NPO. Rationale. Documenting simple data, INO, is a non-complex, routine task that can be performed by the UAP. The fact that the client is NPO makes the INO measurement less complex. Incorrect options. 1. Removing an NG tube involves a skill and requires assessment of the client's readiness and risk of aspiration, which is beyond the UAP's scope. 2. Obtaining a clean catch specimen requires detailed client teaching and assessment of understanding, which is an RN function. 4. Assessment of a wound's healing status, a stage 2 ulcer, requires clinical judgment and is an RN function. Clinique RN Test Day Tip. If a task requires any assessment, teaching, or clinical judgment, it belongs to the RN or LPN. If it's pure data collection or routine care, it can go to the UAP. Question 27. Therapeutic communication in delusion. A client with schizophrenia states to the nurse, "They put a microchip in my brain, and the government is watching me right now." The nurse's most therapeutic response is, 1. I know you believe that, but the government does not implant microchips. 2. Tell me more about the microchip and what it does. 3. That sounds frightening. I don't see a microchip, but I understand you are worried. 4. You should distract yourself by joining the group therapy session right now. The correct answer is 3. That sounds frightening. I don't see a microchip, but I understand you are worried. Rationale. This is the most therapeutic response. It acknowledges the client's subjective feeling, "That sounds frightening," avoids arguing with the delusion, "I don't see a microchip," and validates the underlying emotion, "I understand you are worried." This builds trust and lowers anxiety. Incorrect options. 1. This directly challenges the client's delusion, which can lead to agitation and distrust. 2. This encourages the client to elaborate on the delusion, which can reinforce the false belief. 4. This is giving advice and minimizing the client's distress. Clinique RN Test Day Tip. For clients experiencing a delusion, the key is to validate the feeling, not the delusion. Never argue with the delusion. Question 28. Burns fluid shift. A client has sustained full-thickness burns covering 40% of their body. In the first 24 hours post-burn, the nurse should be most concerned about 1. Massive fluid shift from the interstitial space to the intravascular space. 2. Massive fluid shift from the intravascular space to the interstitial space. 3. Increased cardiac output and bounding pulses. 4. Hyperkalemia and metabolic alkalosis. The correct answer is 2. Massive fluid shift from the intravascular space to the interstitial space. Rationale. Burns cause a massive inflammatory response, leading to increased capillary permeability. This causes plasma proteins and fluid to leak rapidly out of the blood vessels, intravascular space, and into the surrounding tissue, interstitial space. This results in severe, life-threatening hypovolemic shock. Incorrect options. 1. Fluid shifting into the intravascular space would cause hypervolemia. 3. The client's cardiac output drops dramatically due to hypovolemia. 4. The initial injury causes hyperkalemia due to cell lysis and metabolic acidosis due to poor tissue perfusion, not alkalosis. Clinique RN test A tip. For burns, the immediate concern is shock. Remember, fluid to out to edema and finally shock. Question 29. Chest tube bubbling. The nurse is assessing a client with a chest tube connected to a water seal drainage system. The nurse observes intermittent bubbling in the water seal chamber. The nurse should 1. Check the system for an air leak and tighten all connections. 2. Document the finding as normal and continue to monitor the client. 3. Increase the suction setting on the chest tube drainage device. 4. Prepare for a chest tube removal as the lung has re-expanded. The correct answer is 2. Document the finding as normal and continue to monitor the client. Rationale. Intermittent bubbling in the water seal chamber that coincides with the client's respirations is a normal finding. It indicates that air is being expelled from the client's pleural space during exhalation, air leak from the lung, which is the intended function of the chest tube. Incorrect options. 1. Checking for a leak is necessary for continuous bubbling, which indicates a leak in the system. 3. Increasing the suction will not resolve the bubbling. 4. While the bubbling will eventually stop when the lung is fully re-expanded and the air leak is sealed, the presence of intermittent bubbling means the lung is not fully sealed yet. Clinique RN test A tip. Remember the bubbling rules. Intermittent to normal, air leaving lung. Continuous to problem, system leak. No bubbling to resolution or obstruction, problem. Question 30. Post-cardiac catheterization. A client who underwent a right femoral artery cardiac catheterization 2 hours ago reports numbness and tingling in the right foot. The nurse assesses a pedal pulse that is present but weaker than the left side. The nurse's priority action is to 1. Encourage the client to move the right foot to promote circulation. 2. Elevate the head of the bed to 45 degrees for comfort. 3. Obtain a Doppler to assess the dorsalis pedis pulse. 4. Call the healthcare provider immediately. The correct answer is 4. Call the healthcare provider immediately. Rationale. The client is exhibiting signs of arterial occlusion, numbness, tingling, diminished pulse, distal to the catheter insertion site. This is a critical, limb-threatening emergency caused by a thrombus or embolus. The nurse must immediately notify the provider and the rapid response team to prevent ischemia and potential loss of the limb. Incorrect options. 1, 2, and 3. These are all delaying tactics. While checking the Doppler is a good assessment, the priority is immediate escalation of care for this acute vascular issue. Elevating the head of the bed may increase bleeding risk at the insertion site. Clinique RN test A tip. After any arterial puncture, catheterization, ABG, new neurovascular changes, pain, pallor, pulse changes are a limb-threatening emergency and require immediate escalation of care. Great job making it this far. If you want to keep testing your skills, click the link at the top corner for our daily NCLEX test at Clinique RN. New questions every day. Don't forget to like, subscribe, and drop a comment with your score below. Let's keep learning together.